Helping the poor is making some people rich. Next on the American Life League Report. You may recall that last spring, Bishop Thomas Olmsted announced that a nun excommunicated herself for authorizing an abortion at St. Joseph's Hospital in Phoenix. And after St. Joseph's and its parent group, Catholic Healthcare West, refused to acknowledge the immorality of the abortion, Bishop Olmsted announced that the hospital is no longer Catholic. But not 24 hours after Bishop Olmsted's announcement about St. Joseph's Hospital, Sister Carol Keehan of the Catholic Health Association had this to say. St. Joseph's Hospital and Medical Center in Phoenix has many programs that reach out to protect life. They had been confronted with a heartbreaking situation. They carefully evaluated the patient's situation and correctly applied the ethical and religious directives for Catholic healthcare services to it, saving the only life that was possible to save. This is the same erroneous reasoning that Bishop Olmsted specifically rejected after a full review of the case. So why is Sister Keehan even tossing in her comments at all? I mean, what does she have to do with this case? Well, as it turns out, Catholic Healthcare West isn't just, as Sister Keehan stated, a valued member of Catholic Health Association, but the CEO of Catholic Healthcare West has been the chairman of Catholic Health Association's board for the past 3 years. Check it out. Catholic Healthcare West is a member of the Catholic Health Association. Lloyd Dean is the head of Catholic Healthcare West, and Sister Keehan is the head of CHA. But Lloyd Dean has also been the chairman of the board for CHA. So apparently, the fact that both groups are ignoring the bishops on Obamacare, and the fact that they are now ignoring Bishop Olmsted is not a coincidence. And what's truly staggering is how these organizations conduct business. Both Catholic Healthcare West and the Catholic Health Association style themselves as nonprofit organizations who place helping the poor at the top of their priority list. Well, okay, that's good, but if helping the poor is such a priority, why is Catholic Health Association helping itself to 25% of its annual budget to pay for 6 employees, including Sister Keehan's $900,000 a year salary? And from Catholic Healthcare West, Lloyd Dean is being paid a whopping $8.8 million. Who would have guessed that helping the poor was so lucrative? And here's something else to ponder. Considering that Sister Keehan defended an abortion by a valued member of the Catholic Health Association, she probably doesn't have any problems with the list of activities that we reported, such as the sterilizations performed by CHW staff physicians, or the fact that CHW's chief executive officer was the co-architect in the creation of a city health plan called Healthy San Francisco. On its brochure, Healthy San Francisco lists family planning services as one of the services covered, and according to the San Francisco Chronicle, this includes abortion. And there's CHW's Community Grants Program. Every year, CHW members grant funds to groups in their communities, including pro-abortion and pro-homosexuality groups like the Glide Health Center and the San Francisco Health Plan. San Francisco Health Plan's 2010 Summary for Providers plainly states that it covers abortion for children as young as 12. And the Glide Health Center runs homosexual activist groups, while its founder, Cecil Williams, has presided over same-sex weddings for over 4 decades. The real question here is just how Catholic are Catholic Healthcare West and the Catholic Health Association anyway? Given how these two organizations defied the bishops on Obamacare, defied church moral teaching by defending an abortion, and betray the church by funding her enemies, how else are they going to betray the church and her bishops?
We're working closely with our bishops.
Thankfully, Archbishop Niederauer has taken Bishop Olmsted's startling discoveries to heart and has announced that he is initiating his own inquiry into Catholic Healthcare West, whose headquarters are in his archdiocese. And while that conversation is taking place, perhaps the USCCB should reconsider its relationship with Sister Keehan and her magisterium of nuns. For American Life League, I'm Michael Hitchborn.
American Life League's projects, like the video you just watched, are made possible through the generous contribution of our donors, who believe in the sanctity of life and human personhood. Consider supporting our work. Visit us at all.org today and click the donate button. Your monthly pledge to American Life League helps us to save more babies.